I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and it is Motivation Monday. We are talking about men's health the whole month of November, and this week we're going to specifically focus on the prostate. So guys of a certain age, if you're going to the bathroom frequently, you don't feel like you're able to fully empty your bladder, you're having to go more often, you're waking up at night a couple times, 2, 3, 4 times a night to go to the bathroom, and it's disrupting your sleep. This can really be very disruptive and also interrupt other activities throughout the day because you got to stop what you're doing to go to the bathroom. If you're having a split stream or an intertwined stream that looks like a DNA helix, that can be a sign that there's some pressure from the prostate interrupting your bladder flow. So let's look at the anatomy. So in the anatomy here, the prostate is a walnut-sized gland, and when it's healthy, it should have the texture of about pushing on the tip of your nose. You know, it's a little bit firm, it's a little bit mobile, it's got a little bit of good give, but it's not super hard and it's not super mushy or squishy. It's right on the inside of the perineum, and a lot of lay people call the perineum the taint. So you make sperm in the testes, and then that travels up the vas deferens and mixes with some other glands, including the prostate and the seminal vesicle. Those all make seminal fluid, which nourishes the sperm so that it's got what it needs to move along if you're trying to make a baby. All of those things you can see from the graphic, everything comes together there, and the urethra also goes through the prostate. So it's a really tight space with a lot of things going on in that one little spot. So if your prostate gets enlarged, which is really very common as men get into their 40s, 50s, 60s, and beyond, it can really put some pressure there and create some problems when you're trying to avoid your bladder. The most common problem I want to talk about is BPH, or benign prostatic hypertrophy. So this is where there's swelling of the prostate gland, and there's a theory that the testosterone gets converted into dihydrotestosterone there, and that creates some swelling in the area. And dihydrotestosterone is also responsible for male pattern baldness and some hair loss, and it's basically testosterone on steroids. There's research to suggest in this area that frequent ejaculation is very helpful, especially if you're in your 20s. But if you're suffering from this problem in your 50s, 60s, whatever, it's a little late for that advice. Although I do recommend clearing out all of the pathways there so that you don't get a buildup of fluid and you're completely flushing out the line, so to speak. 3 times a week is a good number to aim for. You can also get prostatitis in this area, and there are different kinds of prostatitis, but that just means inflammation of the prostate gland. So prostatitis can be bacterial, so it can be an infection, or it can be non-bacterial. So there's just inflammation there, and it doesn't have to be an infection, it's just inflamed. So that can cause a lot of swelling, and it's a really common cause for pelvic pain for men. Unfortunately, because of the way that the anatomy is constructed, there's not a whole lot of direct blood flow to the area. So if you have prostatitis, sometimes they'll give men antibiotics, but because there's not a lot of blood flow, it's hard to deliver the antibiotics to the area if you're dealing with a bacterial infection. So that can be hard to treat as well. And then finally, there's the biggest thing that men worry about, and that is prostate cancer. So most men will eventually, if you live long enough, get prostate cancer. Thankfully for most men, it starts out microscopic and it's very slow growing, and it's not life-threatening, and so can be very much not a big concern for a lot of men, even if you happen to have prostate cancer. But occasionally it can be very aggressive and needs to be addressed. It's estimated that by the age of 70, 50% of men have prostate cancer of some type. Again, that's really slow growing and microscopic and not anything to be super alarmed about. And by the age of 90, almost 100% of men have prostate cancer. So it is something that you need to have on your radar, be aware of, and be tracking, but not necessarily be fearful of. The way that this is usually detected for men is with a prostate exam. No men really love that. It's not a great test, but it is pretty simple and straightforward, and it's pretty reliable. You can also test your PSA, or your prostate-specific antigen, and that is a blood test. It's a pretty simple blood test, so you want to make sure that you get that done, though, before you have the prostate physical exam, because if you irritate the prostate, you can cause a rise in PSA. There's debate about the PSA and whether it's necessary or not, so a lot of doctors are not routinely checking PSA, but if the prostate-specific antigen is rising, it can be an indication that you have something going on with your prostate, and you could potentially have prostate cancer. So it's a good thing to monitor. And if you've been diagnosed with prostate cancer, then it's good to monitor your progress with treatment and make sure that those numbers aren't rising rapidly. A lot of times, even if you have prostate cancer, like I said, it's usually not aggressive. So So it's a completely valid thing to just watch and wait and keep an eye on. But that means that you need, fellas, to stay up to date with your regular checkup so that you can keep an eye on it and make sure it stays in check. On that note, if you are having prostate issues, a lot of things can be helped conservatively. If you're really struggling and surgery is on the table, make sure that you really go through all your options with your urologist, because removing the prostate or having surgery in that area can be very problematic because it is such a delicate area with a lot of structures there. One of the side effects from having prostate surgery can be urinary incontinence, which nobody really wants to deal with, and or sexual dysfunction. So those are problematic side effects. You want to weigh your options very carefully. If it's you living and being cancer-free versus those side effects, obviously it's better to keep you around, but you really want to go into it with your eyes open with a full disclosure from your surgeon about what the likely outcomes are going to be. Stick around. We're going to talk about other ways to address prostate health throughout the week this week, and I will talk to you later. Hi, I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and it is What's Good Wednesday, and we are talking about men's health the whole month of November. This week in particular, we're talking about prostate health. So I want to talk about ways to prevent hormonal issues that could lead from the most common problem with the prostate is benign prostatic hypertrophy or swelling of the prostate, and that's often linked to testosterone converting to dihydrotestosterone. So we want to balance out the hormones to prevent that crossover and hopefully leave your prostate in a healthier place. One of the first things to do is deal with your stress. When you're stressed, your cortisol rises and causes a whole lot of problems with abdominal weight gain or visceral fat or belly fat kind of thing. And that increases inflammation and it increases estrogen and it will throw your hormones completely out of whack. It leads to a feeling of fatigue and your adrenals are already like whacked out from having to push out cortisol. That leads to fatigue. And so you just feel tired and sluggish and So dealing with stress is the number one thing to help support your hormone balance that I can think of. Additionally, when we talk about that, I really like to talk about increasing fiber. So making sure that you have a really great varied source of fiber in your diet can be really important. It helps with your gut health, and fiber also binds to excess cholesterol that you don't want hanging around and leading to heart disease. It also binds to excess hormones that your body doesn't need and carries them out via your stool so that it doesn't break down and turn into dihydrotestosterone or funky forms of hormones that you're trying to get rid of as a waste product. If you are more of a meat and potatoes person, there's nothing wrong with that, but you do have to get the fiber in there somewhere, and you need a lot of the nutrition that's in other things. So if you have a real big aversion to vegetables, one thing that I've had work for other people is they go to the Asian market. Like around here we have Uwejimaya, and they go in and get exotic fruits and vegetables, things they've never heard of before, things they don't know if they like or not because they've never tried it, and then just start experimenting with sort of more exotic plant foods and see if there's something in there. So that can be really fun, and then you're not just stuck eating broccoli every single night. Normally about 5% of your testosterone is converted to dihydrotestosterone, and that happens along a pathway that uses an enzyme called 5-alpha reductase. So I'm going to talk to you about some natural products that reduce the activity of 5-alpha reductase so that it's not transferring the testosterone to dihydrotestosterone, which we talked about already leads to swelling in the prostate as well as male pattern baldness. So one of the really common and easy things that slows down that process or blocks it is green tea. So the ECGC in green tea blocks the 5-alpha reductase pathway. So that can be one way that's pretty easy. Just make yourself a cup of tea a couple times a day to reduce that. Coconut oil, in particular, the medium chain triglyceride lauric acid blocks that pathway as well. And I think coconut oil in general does well in high heats, can be used for a lot of different foods, and in general is a decent fatty acid that you can use. Other things like onion, spinach, kale, asparagus, berries, all of those are high in quercetin. And if you've heard me talk, I talk about quercetin a lot because it's really good for dealing with allergies. It's also a potent antioxidant. It's also a zinc ionophore, which means that it helps transport zinc into the cell instead of just hanging out outside the cell, which can be helpful for your immune system. But the quercetin also works as a 5-alpha reductase inhibitor. And then turmeric, which has been really well studied for reducing inflammation inflammation. Like turmeric's had just a big heyday in the past 5 to 10 years, where it's been really well researched for a lot of different things, and it's a great anti-inflammatory, but it may also disrupt the 5-alpha reductase pathway. And then pumpkin seeds, those are a great source of zinc and can be very helpful in increasing fertility. They also have some magnesium and other antioxidants. Those have been linked to increased sperm production, so if you're trying to get pregnant, that can be helpful. Edamame, which is young soybeans, that's often an appetizer, and soy isoflavones can be really helpful. You have to be careful with soy because too much soy can have an estrogenic effect, and in general I like fermented soy. Soy isoflavones also can be really helpful for cholesterol levels, and they can have a lot of other benefit, and in moderation that's fine. So I wouldn't want you to have some soy protein powder smoothie 3 times a day every day, but once a day or 3 times, 4 times a week is totally fine. Fenugreek, which is a spice and a seed, that can also block dihydrotestosterone formation, and it also helps with blood sugar. So if you're doing dual duty and you're on the edge of diabetes and have high blood sugars, then fenugreek may be helpful for you. Lycopene, which you may be familiar with, it's in tomatoes and a lot of red colored foods. That also has been shown to reduce dihydrotestosterone and insulin-like growth factor. So that can be really helpful for both prostate support and hair growth. That includes not just tomatoes, but grapefruit and apricots, guava, watermelon, all have lycopene in them. So there's a whole bunch of food things to try and start incorporating into your diet if you are concerned about too much dihydrotestosterone, enlarged prostate, otherwise known as BPH, or male pattern baldness and hair loss. I will see you again on Tactical Thursday. Hi, I'm Dr. Angela McKaye, chiropractor and naturopathic physician, and this week we are talking about prostate health. The whole month of November we're talking about men's health, so stay tuned if you're a man or you have a man in your life that you care about. Today is Tactical Thursday, and we're going to talk about different aspects of prostate health. We're going to start with benign prostatic hypertrophy, since that's so common. And so what I want to say about that, we talked about some foods that can be really helpful for blocking the conversion of testosterone to dihydrotestosterone to take some of the pressure off there, but there are other things that you can do. So flushing the area can be really helpful. We talked about how important it is because the prostate is where the seminal fluid mixes with the sperm, just to flush the line through ejaculation. 2 to 3 times a week is a good number to start with that. Other things that you can do if that's not comfortable for you or it's not enough can be hydrotherapy. So there are different ways that you can go about that, but we talked about where the prostate's located. So a sitz bath can be very helpful. So you can sit in a tub with warm water to encourage blood flow to the area, because we talked about the fact that the prostate does not get great blood flow. So you can sit in a warm tub, and then you can use, if you have the kind of shower head that you can pick up and move around, you can just spray the perineum with some cold water and do alternating hot and cold. So you could do like 5 minutes of warm water with 30 seconds of cold, and do that about 3 times to help flush the area out, and finish off with cold water, because you don't want warm to cause blood pooling in the area that can cause congestion, and if you have BPH, already got congestion in the area, so we want to move things along. If you're concerned about prostate cancer, first of all, you want to talk to your urologist and see what your options are, but diet plays a crucial role in dealing with prostate cancer. So they found that Asian men across the board all had lower rates of prostate cancer. Plant-based diets in general have an association with a lower risk of colon cancer, probably because of fiber sweeping through and cleaning house, a lower rate of breast cancer for women, and a lower rate of prostate cancer. So eating a plant-based diet can be really important in reducing your cancer risk. You get a lot of micronutrients, you get a lot of fiber, and a lot fewer contaminants potentially than eating a meat-based diet. That doesn't mean you have to give up meat if you love meat. You don't have to give it up completely, but you can think of it more as a condiment, or still eat meat as you have been, but just really make sure that you're getting a whole lot of vegetable and plant material as well. And so if your concern is cancer, you want to make sure you're getting lots of fiber so that you can eliminate as many toxins as you can from your body and get that out, and make sure that you're getting adequate vitamin D, because vitamin D has been shown to be helpful at least with later stage prostate cancer, but vitamin D deficiency is rampant and it can cause a lot of problems for a lot of people in a lot of ways. So staying on top of your vitamin D is really important as well. So we have been talking about 5-alpha reductase inhibitors, and that is any substance that keeps your testosterone from converting to dihydrotestosterone, which can get kind of gnarly if you have too much of it and lead to swelling of the prostate as well as male pattern baldness. There are pharmaceutical 5-alpha reductase inhibitors, and that is definitely an option if it's warranted, if you really need it. But I want to talk about some herbs. We talked about some foods that work on this pathway, but let's talk about a few herbal options that may be an appropriate step, just short of doing something pharmaceutical. So some of my favorite herbs that are 5-alpha reductase inhibitors include saw palmetto, which the science has waffled a little bit, but it has been traditionally used for prostate health, and this is why it works on this pathway. It's often combined with nettles, which you can take as a tea. Nettles by themselves have a lot of minerals in them and have been long used as a food, especially during hard times, and they're abundant in the springtime. So people will harvest nettles and make nettle soup. And it was really common in lean times, like during the World War II era, where people had food rations and needed to get as much nutrition as possible and could just forage for them. Other things that can be helpful is African cherry bark, which is also known herbally as pygeum, and that can be useful also. So sometimes you'll see over-the-counter formulations with saw palmetto, stinging nettles, and maybe pygeum or African cherry bark all together, and those can work really well for reducing 5-alpha reductase and that transition from testosterone to dihydrotestosterone. I hope you've enjoyed this week on Prostate Health. If you have any questions, drop them in the box, send me an email, let me know what you think. Thanks.